In 2003, I had a massive heart attack. The type of heart attack that I had was a blockage of the left anterior descending artery, and that one is referred to commonly as the widowmaker. In most instances, the first symptom of blockage in that particular artery is death. I was whisked to Chinook Regional Hospital in Lethbridge and triaged through the emergency system there. And although I was flown on fixed-wing aircraft to Calgary the next day, Chinook Regional Hospital kept me alive in the ICU. After the heart attack itself, my life was affected in that I didn't have quite the same strength, the same pep, the same vigor. Some of that was helped by cardiac rehab. Certainly I had to make some lifestyle changes, but those changes were made successfully, and yeah, I have been moving forward ever since. I have been a member of the Oldman River Region Health Advisory Council since the fall of 2016. I thought that being on Health Advisory Council was an opportunity maybe to not only give back, but to influence how health services are being delivered in Oldman River Region based on pretty significant lived experience.
One of my favorite meetings of the year is actually meeting with the Health Advisory Council chairs. We've been very purposeful to make sure that the councils are very representative of Albertans. Every community is different. So if we don't really know what's important to Albertans, if we don't understand the communities they live in, the type of services they have or don't have, how do we know whether we're missing the mark or not?
I'm Lucille Partington, and I live in the north of Alberta in a town called Sexsmith, Alberta. I had 3 sons, and then that wasn't enough. So we adopted a beautiful daughter and 4 children in that family. Now we have the youngest grandchild. So I'm currently chair of the Peace Region, and of course the co-chair of all of the Council of Chairs across the province. Really, they're the voice of the community because they live across the whole province and are in touch every day with people that are using the healthcare system, and they know what works for them and what doesn't work. So it's our job to gather information about what's important in our regions of Alberta from the citizens.
I think people join the council because, like me, they have an interest in and willingness to give back to their community.
If I look at the members of our councils right now, what I really admire about them is their passion for the community and their passion for trying to make a difference. You know, at the end of the day, our success as a health system can only be judged by the users. And who are the users but Albertans?
We are, in the truest sense of the word, advisors. We are counselors. We are not executive bodies. We are not in any positions of authority. What we are is a sounding board for Alberta Health Services to gauge just what their thinking is going to look like in the real world and how it's going to be graded by people who will be affected by it.
Together, we do amazing things every day.